It's embarrassing to represent a tech organization and struggle with these things, but yeah. Okay, thank you everyone. This was such an insightful discussion that we had. I think we'll have to put in some extra effort to top that to keep our audience engaged. So good afternoon, good morning, and good evening to those who are joining us from different time zones. I'm Nakul Jain, CEO for Wadhwani AI Global, and it's a privilege to moderate this session today. Today's session is being hosted by PATH in collaboration with ICMR-National Institute of Research in Digital Health, Wadhwani AI Global, and Transform Health as an official pre-summit event under the India AI Impact Summit 2026. What we hope to surface here today are opportunities, risks, and concrete next steps that will feed directly into the wider summit agenda on AI for public good and universal health coverage summit event. A quick note on how we want to run this is we really want this to be a working dialogue, not a one-way webinar. Please use the question and answer box throughout the session to share questions and reflections. We'll bring selected questions into the discussion during the Q&A segment, and speakers may also respond directly in the chat where possible. Now, in the previous session, we have heard about immense potential of AI to expand diagnostic access and strengthen health systems at the last mile. But potential only becomes impact when it is built on foundation of trust. This session, relevant health data governance for shaping the emerging tech ecosystem, focuses on that foundation. The central question before us is how do we design health data governance in the global south so that AI in health is trustworthy, inclusive, and aligned with universal health coverage rather than deepening existing inequalities. We are fortunate enough to have four leaders who are building this foundation from different complementary angles. I'd like to welcome Dr. Suhaila Kapoor. She's a senior consultant with ICMR, National Institute for Research in Digital Health and Data Sciences. Dr. Suhaila Kapoor is a senior is a senior computational neuroscientist and digital health strategist with over a decade of experience advancing AI-enabled healthcare across policy, research, and real-world implementation. She has had senior roles at leading public health institutions, including PHFI, Tata Trust, and Japaigo, and she currently serves as a senior consultant at ICMR's National Institute for Research in Digital Health and Data Sciences. Welcome, Dr. Suhaila. I also welcome Mr. Srikanth Nadamuni, who's a co-founder and managing trustee for eager Foundation. He brings the hard-earned lessons of building national-scale identity, that is Aadhaar and other data systems, and how those lessons apply to health and AI. I welcome you. I also welcome Ms. Kirsten Mathieson. She's the Deputy Director and Policy Lead at Transform Health. She's at the forefront of global work on health data governance principles, model law, and ensuring that governance frameworks are genuinely helping with equity and they are right-based. Welcome to you. Finally, Sameer Kanwar, who's the Director for Digital Health, AI and MedTech from PATH. He has over 3 decades of experience in digital information and communication technology domain and has been part of strategic think tanks for adoption of technology across different verticals. His area of expertise includes strategic planning, design, adoption, and implementation of cross-cutting technologies across different programs in an integrated manner to achieve continuum. Presently, he's the Director for Digital Health with PATH and supports the South Asia region. I welcome you, Sameer. Okay, so together we'll unpack what inclusive, trustworthy health data governance actually looks like in practice and what concrete steps governments, coalitions, innovators in the global south should be taking in the next few years. So let's quickly dive in. My first question is for Dr. Suhaila. You're leading India's national effort to build institutions and method for evaluating AI in real public health setting. ICMR-NIR-DHDS is one of the few institutes in Global South, right, with a dedicated mandate to evaluate AI tools for health. Now, when an AI tool wants to be deployed in India's public health system, what does your evaluation process actually look like? And what have you learned about these tools, which tend to succeed or fail once they hit India's diversity and real-world constraints?
Right. Thank you so much for having me on this panel. Thanks, Nakul. And to the other panelists, also a warm welcome from my side. I'm sorry I'm unable to figure out my background, so I'm just going to stop trying. Yeah, it's kind of embarrassing when you're doing AI evaluations for India. You're not able to figure out your own background exactly what you
I
said.
second you, sir.
I know.
But
Uh,
but your painting looks good.
that's what I thought. I said, let's just go with that. It's not a bad background. It's a real background. That's what's important. It's a pleasure to be here today, joining all of you on this very esteemed panel. And I also like to thank Dr. Mona Dugal for nominating me, who's the director for the National Institute of Research in Digital Health and Data Science at ICMR. I've had a fantastic experience working with her. Um, Fortunately, yes, for us, we are right now at the forefront of supporting deployment and evaluation of AI and digital technologies in India in the healthcare domain. ICMR is leading the mandate for that, and our institute, housed within ICMR, is at the fore of that. To your question, which is a very valid question, I think where we're really coming out across is in understanding that AI evaluation um, is sort of a continuum. It's not really a checkpoint. It doesn't really start at one point. It's actually this entire life cycle of deployment, right from identifying products at their pilot levels to when they go into initial stages of like deployment. Um, Extending that through scale up, and then finally looking at the post market surveillance. So that entire life cycle is where we really like to interact and engage. And there are four, let's say, yeah, there are about four primarily interconnected layers where we try and evaluate these various products and engage with them. So while we're evaluating, we're also apprising them, because I think the like regulations are still coming to the forefront. Innovators are yet to understand and absorb them fully and to integrate them into their own workflows. So we also see that as a very important role, is not to only oversee, but to actually support. The first step, which we really work at with various innovators, is to look at the technical or a clinical viability and the validity of these various products. Um, I think it's very important to ensure that AI is precise for whatever intended use it is meant to be, and it's purposeful. And I very strongly believe in this, like retrofitting solutions because they're high tech into simpler, easier ways of solving them is not the way to go about it. So only when AI is actually purposeful, it's useful with very clearly defined use cases, is when we can expect beneficial outcomes. And you can do this when you identify very appropriate performance matrices, so what kind of objectives one should be achieving with those various AI tools, right? What kind of analysis should be going about? What kind of a subgroup analysis are we? Should one be figuring out during implementation of these AI tools? And if there's enough explainability, I think that's been a key word across all AI deployments. If the tool is actually explainable to the consumer, to the like user of the AI tool, to the innovator firstly, to the user, and then to the end consumer. So making sure that the output is actually well interpreted and can be acted upon is the first step. So that's making sure that it's clinically viable, it's valid. The second in India is very critical to look at contextual fitness of any AI tool. We always say India is a subcontinent, it's a huge country, we're very diverse. And that's where I think, the, so-called like, kind of, like whether a tool is actually strong and like robust enough can actually be tested and trained in various environments. I mean, of course, tools work really well in controlled settings, but the moment they move into these wide heterogeneous environments is where the actual like rubber meets the final road, and we can test whether it's happening. So to look at variability in terms of linguistics, epidemiological variability, infrastructure availability, internet usage and not, and more than anything else, workforce competency. Whether the people are actually being able to use these tools in different contexts becomes equally important. The third thing we really want to check for when we're looking at tools is to look at how well do they integrate into systems. So where is the human centricity behind the full design, right? Sitting in an ivory tower and building a solution and not imagining how it's going to get consumed by the frontline worker, the ASHA, the medical officer, the community health worker is an unfortunate recipe for failure. So making sure that there are enough like reporting mechanisms, there are enough pathways by which various weaknesses or any sort of surveillance can be actually addressed, becomes a very important area for us to verify and to check for. And the fourth is something which we really talk about and strongly believe in, is to look at the post-market surveillance. No AI tool is a static tool. Once deployed, you can't forget about it. Situations are continuously evolving. Public health systems are themselves changing. Models, of course, drift. We know there's a lot of model drift. Safety becomes an issue at times, and there might be unintended consequences. So making sure that once a tool is in the market, there are enough governance arrangements, enough feedback loops, if one wants to call them, and accountability structures in place, which allow us to make sure that the tool is being monitored. And even if there is a withdrawal, which might be at times required, that can be seamlessly carried out. So this is the entire continuity of evaluation, right from pilot to deployment to post-market surveillance. Having a life cycle kind of a governance mechanism in place in a real world setting is what we very firmly believe at ICMR's NIRDHDS, to make sure that these tools work well, they work as they are intended, they are consumed well by their end users, and we are able to achieve whatever health outcomes that they are meant for.
Oh, that's no very, very important. In fact, I love the fact that AI evaluation is a continuum. It's not a one-time activity. And I think what essentially brings out in whatever you just told us is we should not try to throw problems at solutions, right? And it should be the other way around. Kirsten, you work with governments and civil society to define what good health data governance for AI should look like, especially for equity and UHC. Now, when a government official asks you, what does inclusive health data governance actually mean if we care about universal health coverage and equity? What are the three non negotiables you will tell them that they must get right on health data governance, even if they can't do everything at once?
Thank you. Yeah, and it's great to be here today on this panel. It's a great question. And I was thinking through what are those kind of really three core non-negotiables that need to be really pushed. So I think really, first of all, just in, what does inclusive health data governance mean? And I think just really ensuring that we're designing those rules, systems, decision making around data and data use, and in design them intentionally to ensure that they're fair, representative, transparent, and beneficial for all populations. And they're also particularly looking at populations that are often underrepresented, marginalized, or more at risk of harm. So being very intentional about that and really ensuring that inclusive governance is it's rights-based, it's equitable, and it's people-centered, and really having those issues at the forefront as we're designing those rules and systems. That needs to be very intentional, and therefore the three non-negotiables I would say is having very clear kind of guiding principles and frameworks to give a very clear value-based guidance and foundation for health data governance. I know in the previous panel discussion, there was talk about principles, and it is true that principles they're not enforceable, they're not binding, but where it is important is it sets out that very clear intention of what is needed. And so that should kind of underpin and be that strong foundation for health data governance. This scenario that Transform Health, we've been working on quite a lot, and along with a number of our partners, stewarded the development and launch of a set of health data governance principles in 2022, taking a very inclusive and consultative approach to their development. And they've since been endorsed by more than 170 organizations and some governments as well. And they give a very strong human rights and equity lens to the governance of health data so that all people and communities can benefit from the health data. So really there are 8 principles clustered around 3 core areas. The first one around kind of protecting individuals and communities from data misuse, from exposure, et cetera. Really promoting health value. So to really enable the responsible use of health data for public benefit, to improve health equity, outcomes, facilitate innovation, enhance health systems. And then the third cluster is really around that prioritizing equity. So really ensuring that all groups are represented in and benefit from the health data. So that kind of value creation from it and making sure that flows back to the populations as well. So I'd say that being that first non-negotiable is having those very clear, intentional principle foundations to the health data governance. Second area, so recognizing that that gives that vision, but they're not necessarily enforceable, is then ensuring really robust legislative and regulatory frameworks, which gives that more kind of binding nature and obligation for all those involved around the collection or use of health data. And, you know, as you said, countries are at different stages with this, but having that kind of intention to work towards strengthening that legislative framework. So having those laws in place that would safeguard people's privacy and rights, mitigate data misuse, laws that ensure transparency and accountability, that promote responsible data use, and that are very much equity and rights focused. And then it came up as well in the previous discussion of ensuring those laws very specific around health data as well. So a lot of countries might have their data protection laws, but the need for health-specific legislation, just recognizing the sensitivities and elevated risks around health data and the need for those kind of legislative protections around that to uphold people's rights. But then also just recognizing that health is such an important type of data that has that personal value, and it's a personal asset, but has a very important community value and community asset. So kind of the right legislative frameworks for that. And the third non-negotiable area, I would say, is really around ensuring community engagement and inclusive processes. So making sure that populations and communities are informed, engaged, empowered around their data rights. As part of some of our work on health data governance, we have a My Data or Health campaign, which is aimed and positioned specifically for this to kind of raise public and political awareness around the importance of personal health data, public benefit, the need for action to ensure good governance, to really kind of mobilize and engage communities around the issue. But then it's important that communities and populations are also included and involved in more inclusive processes and accountability around health data governance. So ensuring those processes are transparent, people know how their data is being used, what are the laws protecting it, what are the avenues for redress if they feel that their data rights aren't being upheld, for example, ensuring public and community participation in those governance structures and processes as well, and diverse voices, particularly as marginalized communities might be left out of those discussions. So really ensuring they're involved in those discussions. So I think I'd say those 3 non-negotiables around kind of very clear equity, rights-based guiding principles, strengthening the legislative frameworks, and then ensuring inclusive processes and accountability.
Well, thank you. And I think what you also tell us is this doesn't need to be an afterthought. Governance always need to be built in at the inception of anything that we're doing with respect to AI. And I'll move to Shrikant, because I think that brings in a very important sort of a discussion. And we would want to understand your experience. Dr. Sohila spoke about how evaluation framework is a continuum, which means that there needs to be an early thought around how this should be structured. Kirsten spoke about how various laws, guiding principles, community engagement need to be a part of this dialogue well in advance. You have built digital public infrastructure at national scale and seen what happens when governance is built in early versus retrofitted later, right? I mean, Adhar showed us what's possible when you build digital public infrastructure at population scale, and also hard lessons on safeguards and exclusions. If you were advising government on designing their digital health stacks and AI governance from scratch today, what governance mechanism would you insist on building in from day one before they even think of scaling?
Yeah. Aadhaar was India's first sort of massive digital public infrastructure. And that taught us a lot, not just on building technology at India scale or even deploying it, but also what you're referring to, the PIL in the Supreme Court. And I think it was a very useful exercise that India went through for several years. In fact, it was the second longest case in the Supreme Court history with the constitutional bench going through it. And personally, I think we benefited a lot from that angst that the country went through on data sharing and privacy. A lot of quarters took sort of this patronizing view that, oh, rural folks, they need services, not necessarily privacy. And that got corrected in some sense at a massive level when the Supreme Court debated it. And more importantly, the country debated it. And in some sense, the fact that it was so contested and discussed in newspapers for a long period enabled large sections of the population to get sensitized to the issue of privacy, right? So in that sense, I think it was a very good experience. Unfortunately, we didn't have the PDPD laws. In fact, some of those laws came out of the Aadhaar experience as well as the Supreme Court's concern on privacy and data protection and so on. So I would say the systems that need to be developed as we go forward should be very scrupulous about privacy, data protection, now that we have good laws in the country. But at the same time, I'll also say something, for instance, there are parts of the world which have sort of knotted themselves up and made it hard to innovate. Okay, and what I mean by that is we can look at data only from the privacy lens, or we can also look at data from the empowerment lens. Okay, if a bank is ready to give me a loan, if I were to share some specific things about my salary or my property or my income and so on, and if that person really needs the loan, I think it's also overreach for systems to say, no, that's not important enough for you. Okay, your data is more important than your loan, for instance. So we have to strike a proper balance between truly protecting data with a consent architecture, like we have come up with, the account aggregator architecture, versus allowing people the right to use their data to empower themselves, right? So these are some thoughts that come about with respect to what kind of things I would think about if I were to build something at national scale. Also, technologists are often over-optimistic about the hammers that they possess, right? Me included. So it's always good to let the government, the policymakers, the activists have their opinions coming out and discussing that while you build the product. So in fact, we had a good active group of NGOs that were working with us as collaborators when we were designing the Aadhaar system. And that gave us a lot of insights into especially the exclusions. The disabled folks who couldn't come up to our centers, or children who were in schools who were not going to turn up, women. We learned quite a bit on gender issues, some of them very positive. Just as an anecdote, suddenly we heard from our Ranchi regional office that women love Aadhaar a lot as soon as we launched it. And we were like, why only women? Everybody gets an Aadhaar, so how come? And it turns out that a lot of the NREGA work that women do, they're carrying heavy loads on their head and so on, we're really doing hard work. But when it comes to payment, somebody else goes there to pick up the payment because you have to go to the bank in the district headquarters, and money doesn't end up in the woman's hand who's worked really hard for it. Whereas now with Aadhaar, with a fingerprint scanner, they came to the village with a device and said, okay, you need to go put your fingerprint and take your cash. So they actually got their money, even though this was sort of an unintended consequence, if you will, of the system. So there are gender issues as well. I talked about a positive one, but there are negative ones as well that creep up when you build these massive systems. So I think just the ability to build a coalition of different kinds of views and partners who don't all look at, are gung-ho about technology and cheerleading about, there is AI and there's cloud and there's mobile and so on, is, I think, a useful, healthy way to design these systems. There's also, one of the things we didn't touch about is there's a lot of dangers of AI. In fact, I've written a paper along with a bunch of researchers from OpenAI and Microsoft and whatnot, Harvard and MIT and so on the fact that the deepfakes are going to be much, much worse when you look at cybersecurity, when you look at cyber attacks. So when we design these new systems, especially with AI, which we are talking about, we have to be extremely sensitive about the fact that the number of attacks that are going to come, cyber attacks is going to be manifold, right? And we have to be prepared ahead of saying we'll launch this across the country. And these are some points that I can think of that I would watch out for when you build large-scale systems and go live across India scale.
Super interesting. And, I think privacy versus empowerment, especially, I think something that needs more dialogue, because I see a lot of empowerment and you mentioned some of the examples happen in form of services in kind, but there also needs to be a dialogue, given that, privacy is anyways becoming a more, tricky subject to manage with the advancement of technology. How could there be an opportunity for monetization of at the cost of your privacy? If I'm open to monetizing it, there should not be any problem with that. But how do you sort of have those, measurable data equivalent of monetization matrices that could
Well, my quick answer for that is, I think giving the sort of the consent framework that includes the person whose data you're talking about is the core of this. I hate taking a patronizing view, sort of, I know better, I'd rather give you cash because otherwise you're going to drink it up, and so on. I'd stay away from those and allow people to make decision. Of course, with guardrails to ensure that people don't take illiterate folks and so on to take advantage of them because of their not knowing things. But I think the basis ought to be, we need to respect the person and their data, and they make the decisions. Of course, we have to build the awareness that helps them make those decisions.
Yeah, no, I totally agree with you, Shrikant. Samir, you work at the intersection of governments, implementers, innovators, and funders, supporting countries in integrating AI into public health systems with appropriate safeguards, of course. And Path works with government to build digital health infrastructure. They deploy AI tools within real public systems. Now, from your experience, what are the 2-3 governance elements that consistently determine whether an AI tool transitions from pilot to institutional adoption?
Thanks, Nakul, for the question. The advantage of being the last speaker is that whatever you wanted to say has already been said. So I'll make this and keep this short. So I think each country, to start with, and I will not say governance mechanisms or regulatory frameworks, but needs to define what is good enough for them. Right. In terms of the performance expectations from the tools which are being deployed, because when technology sets in, there are different ways it is tested and implemented on ground. You could be using retrospective data, you could be doing clinical trials, picking up data on the fly. Your models are adapting to their data, and you evolve as you implement. Right. So I mean, there is no one fit for all. But I think where countries struggle, one is how do you break that black box of AI, right? Because that's where the trust sits in, and the governments are not able to find a way to say, oh yeah, I trust this technology, because the innovator is not ready to share the IP or not ready to talk about exactly how the technology is working to a certain extent. Unfortunately, you have a very strong regulatory framework which allows you to open up that black box. So how do you build that trust? I think through the governance mechanism is extremely important. And this works both from the private sector innovator perspective as well as from the government perspective. Now, the second and probably the most important factor for me is, the cost factor of the technology, which probably Neeraj alluded to in the beginning, right? And second is the procurement piece. Now, I may have the best of the technology, fantastic, solves a huge problem for me, let's say in the clinical space. It's been piloted, tested, proof of concept over. Now, how do you scale it up? How does a government procure IP technology? There are no methods and means. So, I mean, the governance mechanisms and the procurement mechanisms need to evolve to be able to procure these technologies. And what are those methods? I mean, there are no solutions which I can suggest, but that's where the technology gets stuck when they want to take it and scale it up, right? And the third and the last is, we do these pilots and test these innovations in very siloed environments, right? It might be a clinical setting, or it might be, a field setting where we tested, fantastic, has worked. But then we forget that there are existing digital systems through which it will probably need to share data, get integrated, become interoperable, right? So that's this third failure which we see when we implement, right? And what's the governance framework, which is available there? I think if we can solve for these three pieces, we would actually see technology scaling up where it is required. And I think beyond that governance framework, we also need to look at whether that technology is contextual to the problem which we've identified on ground or not. Does it work in low resource settings from the technology perspective? Because that's a larger problem in LMICs. If I don't have an internet, is it going to be a single point of failure for me? So a systemic analysis and governance framework which looks at as to how do we solve for those problems. I think if we are able to address these 3 to 4 pieces, I think we would be seeing scaling of AI technologies. I'm afraid of being pessimistic, but I don't think we've seen scaled up AI technologies being used across LMICs as we speak. Thank you.
Oh, thank you, Samir. And it's very unfortunate. I have so many follow-up questions for all of you, but I'm also wary of time. So we'll have to now shift from envisioning what good looks like to confronting the harder realities. Data absence and invisibility, uneven capacity, and responsibility to ensure that public health data and AI truly serve public value in the global south. We'll begin the next round, but I have a quick request. In interest of time, and so that we also give our audiences to ask certain questions, let's try and keep your answers as brief as possible. And I'm sure we'll get opportunity to converse even further. So starting with Dr. Suhaila, for AI in health to serve universal health coverage, the data behind it has to reflect people who are usually left out: informal workers, rural communities, tribal populations, adolescents, women in certain contexts, right? This is exactly what Kirsten Ontlo mentioned about the population that is majorly underrepresented. Where do you see are the biggest data gaps or blind spots in India's current digital health ecosystem, and what is being done to so that these groups don't remain invisible in the AI models we build?
I think you've already said it. And again, just like Samir said, right? Have touched upon these various gaps in our own experiences. I'll probably try and keep this brief so that just to make sure that there are enough questions asked later. What we feel are the largest data gaps are very rarely technical, and they're more it's more from a systems point of view that we're actually feeling the like fragility of systems really come into the fore when any solution is deployed at scale. Works really well at pilot settings, works really well in controlled kind of a controlled setting. But the moment it goes to scale, especially in India, where we've talked about, and you yourself, the question is itself addressing it, where you have population visibility gaps, whether they're tribals, they're adolescents, they are informal gig workers today. All these new apps we have, people riding bikes, e-vehicles at like breakneck speed, no helmets. And I always ask, where is the public health, kind of a measure in place for these individuals? So the entire informal gig community, tribals, women very often. And very interestingly, I was actually reading a couple of weeks ago a post which said one of the other communities which is getting missed out is the actual urban community, because when we ask for consent and all of us say I do not consent to my data being shared, that means the models don't have urban community data really coming in. So there is data missing. It's very fragmented. We don't have enough like longitudinal data at times, which means that the AI models are getting trained in a siloed manner, and they're not fully getting trained very often. So especially if the data is coming in from a facility level, right? It's not being collected, at mass. I think the second important data gap that we've been noticing are contextual data gaps or blind spots, which are around, like socioeconomic indicators, environmental factors, behavioral data, which are very important determinants for health. How do I, behave? In COVID, we saw, whether there was a mask wearing behavior or not, and similarly, and so on, and whether it's hand washing behavior, what kind of a background am I coming from? That's a huge gap that we also feel we are not able to actually capture. And the third one is something which, of course, at ICMR's institute where I'm from, we are working on, which is the, like kind of a governance gap, where we want to make sure that there is enough assurance that the model is fair and accurate, and it's actually beneficial for the people it was intended for, really. And like I also mentioned earlier, without enough post market surveillance and monitoring, these biases creep on. The exclusion gradually does step in. So we want to make sure that some of these gaps are what we are addressing. Very quickly, to summarize what we are doing about it, because of course the problem has been well articulated by not just myself, by many other focus, by many other speakers. We are working with various states at building federated privacy preserving architectures, which allows the data of the state to reside within the very state itself. In India, health is a state subject. So making sure that people are comfortable with sharing data within their own state, with their own governance and like regulators. Also, the second thing I think we really focus on is to just collect sufficient and necessary data which is purpose driven, right? And I think the last point probably would be to, like I had even mentioned earlier, to make sure that we realize that these are all living models, that whatever we are doing goes through various steps, right from pilots to post-market surveillance, and there is enough governance and monitoring across the entire spectrum, and not at just any one checkpoint. So we can continuously check and monitor for any of these issues that I've just right now alluded to.
And you mentioned a very important point around this entire data being absent, right? And Kasim, this leads me to my question to you. This is a reality. There's entire community data that is absent. Like, and how should health data governance framework in Global South confront that invisibility? What is your opinion about that?
Yeah, thank you. Yeah, I think it's an important one because I think there's a lot of discussion about data biases in algorithmic biases, but like you said, a really important issue is it's just missing data. There's, populations are missing within those data sets. So I think needing to be, one, just recognizing, not simply treating it as a technical issue. And I think Dr. Saleh, you mentioned this as well, but really prioritizing it. It's an issue of equity and exclusion, essentially. So it really needs to be prioritized politically. It's a political issue as well, and a governance priority. So a few areas that maybe touch on that I think are kind of need to really be prioritized within this. So going back to what I talked about before is really ensuring those strong and robust legislative and regulatory frameworks. If they're kind of weaker mechanisms or weaker frameworks, it could push developers towards more kind of easily accessible data sets that might be less representative. So ensuring those strong frameworks in place. Really making it a political priority, and therefore allocating necessary funding to address this as well, to ensure that data sets are representative. And a big area around this is really kind of funding around strengthening the health information systems where the data is being collected, going to those areas and places where where the data isn't being collected, where those missing populations are, in a sense, in the data. So really investing, for example, in community systems, community level data, where that invisibility occurs, but really needing to kind of tailor to what is needed to be able to capture that data at that level as well. Strengthening vital registration as well. There, without this, large parts of the populations remain invisible in the data. And then strengthening provider reporting as well. Again, looking at kind of where those missing communities or population data sets are, and ensuring we're kind of strengthening that provider reporting. But I think another really important element is really prioritizing trust within this so that people are happy for their data to be collected, in a sense, do you know what I mean? Because they recognize that there are the needed safeguards in place. They're aware of how their data is being used and therefore are comfortable for the data being used. And I think going back to Srikanth mentioned this point of, the protection element versus the responsible data use and sharing. Data that's purely protected, and of course, sensitive data needs to be protected. Certain provisions need to be in place for that. But data doesn't have any value if it's not used to really further, innovation, patient care, empowering people around their data, et cetera. So, but you need to build trust in those systems. So people that know that their data will be used responsibly and then will be more willing to share it. And a foundation of that is that there are the laws and regulations and safeguards and avenues for redress around that. Two
so
final
much.
really quick points.
Yeah.
I'll say it really, really quickly. Just say as well, really prioritizing community and civil society participation in this then as well, so that there's kind of regular consultation and identifying who remains excluded and why in that data, and then the transparency and accountability. So, regular monitoring, publishing of data, so you can see where the gaps are. The better visibility drives accountability as well to really kind of hold those accountable of where that data isn't being collected. Thank you.
Thank you. And in interest of time, I request audience to feel free to ask questions over the chat. I know some of the speakers will be happy to respond to you over the chat. If we get time to take questions in audio, we'll do that as well. Srikanth, both Dr. Sohela and Kirsten have mentioned some really great principles that we should be thinking about, right? But from your practical experience, we know there's this huge difference between what is on paper versus what actually needs to be done to get this implemented, right? So from your DPI experience, what is the realistic sequence from that messy starting point to a future where AI can be used safely at scale in public health? And where along the path do you see most important points to ensure public data continues to serve public value rather than just private gain? You're on mute, Srikanth.
Oh, sorry. I'm part of this Apex Committee of the Government of India for creating AI centers of excellence in health, education, agriculture, and sustainable cities. And one of the things we're trying to do is not just build models that are useful for us. There was the earlier discussion on diagnostics. We're doing several of those on, breast cancer, oral cancer screening, so on and so forth, diabetic retinopathy, various conditions. But we're also saying, hey, it's not enough to put those models out there for everybody to use, but it's also useful to give good, curated, clean data for other people to build models, right? So the Indian Institute of Science is the AI COE for healthcare, and that's one of their goals. And that's something that we are proactively encouraging them to think about the data sharing aspect of it, and the governance aspect associated with the data and so on. So that is one thing that comes to mind. The other things, I don't know, they're sort of related. You're asking, how do we practically take this AI innovations and build something at scale in healthcare? The other things that come to mind are, even while there are data biases of models that come from other geographies, the context is, I was a visiting scientist for the last 3 months at MIT, and fantastic work going on by Regina Barsley and many researchers there. While those models cannot be directly deployed in an Indian setting because the data that's been collected is from a different population. Many of the learnings on the methods and the way it's been deployed, for instance, Sybil is looking at lung cancer, and so on and so forth. There are many models. There are many other learnings that are still useful. So this collaboration across labs that are doing great work and universities and academia and industry and so on is super helpful. That's why I spent 3 months there just trying to understand how do we empower our IITs to collaborate with MIT and the like to see if we can take it forward. So that is another thought that I have, that we should look at various different approaches and models and see what we learn from them, while we understand that the data distribution that we're sampling from is not accurate, and we might need to do some of that as to start from scratch and get our own data around that. That is another thought that I have with respect to AI. But let me tell you, one of the most the thing that I'm most worried about, I'm quite concerned that AI will increase the divides in our society. The asymmetry, the knowledge asymmetry that already exists without AI is quite large. And when you throw in AI and the exponential speed at which things are developing, a large group of people are going to get left out of this train that's taking off, right? So so how do we solve for this? When Aadhaar was deployed, it went to almost the entire population, 99% of the people plus, 99% plus have that Aadhaar, and UPI is doing 20 billion transactions. Can we get the AI innovations out to everybody? The poorest Indian in the smallest village has access to these healthcare innovations. How do you do that? The answer, I think, lies in something that I think India has contributed, which is digital public infrastructure. So we need to diffuse this technology across the length and breadth of this land, and I'm sure other countries will benefit from this experience, and ensure that equity, meaning you can't just say, hey, I built a beautiful app, everybody, knock yourself out and empower yourself. It's not possible. It's not that easy. Or population scale. Don't start with pilots and say later I'll scale them. That doesn't work. You have to design for scale and then take baby steps in the right direction. So there are a whole bunch of things that we have learned in the DPI playbook with Aadhaar and with UPI and DigiLocker and so on and so forth, that we should use in order to diffuse this technology across the land and not just have, one small group of people benefit from this very powerful technology.
Totally agree. Thank you, Shrikant, for that. Samir, very quickly, one last question for you. For governments, implementers, and partners across Global South who are working on health data governance for AI, what is the one concrete priority you would urge them to focus on in the next 2 to 3 years? Something we could realistically check back on and say, yes, this happened or it didn't, with the definition of done, essentially.
So I think one would be, I will make it two. And the first one would be that how can you define the minimum level of DPI is what Shrikant was mentioning, right? Because if we get into the race of building a full stack, probably countries would miss out, right? And second is, how do you make countries collaborate? The private sector collaborates, but I think where we struggle to see is governments being able to collaborate. Like what Shrikant was mentioning, technology is available, can be picked up, there are learnings available. How can we ensure that what India did in 10 years for Aadhaar can be done in 1 or 2 years by other countries, right? So I think collaboration would be the next piece. Thanks.
Great. Pallavi, do we have time for a couple of questions? I know we are already over time.
Sure, Nakul, maybe we can take 2 questions, perhaps.
Great.
Thank you.
Sorry, I'm just trying to look at the... Oh, I see a few questions. Okay, Praveen has asked, AI's application in healthcare enhances the significance by improving the accuracy and speed of diagnosis and treatment. At the same time, I would like to learn how it remains accessible to general public and ensuring ethical use of public data. Any takers for that question?
Well, like I said, the ensuring equitable access of these technologies is super important, which is what the person is referring to. And a lot of times in private sector, there are market failures because of which that doesn't happen. In academia, they're usually looking at papers and publications, not necessarily enterprise class. Government often is not at the cutting edge of technology, so there are some of those issues as well. So you have to solve for that. And in Aadhaar, we found one solution of how to get private sector and government working together, both agility and innovation combined with the mandate and population scale. So we have to put those together to solve that problem that he's referring to.
Great. Another question from Rodel, the last one. How should regulations balance innovations with ethical AI use, ensuring inclusivity for marginalized groups?
I can take a stab at that.
Yeah, go ahead.
No straight answer, but I think this is work in progress. All governments across, whether it's the global south, the global north, all these terminologies, right, are figuring out how do you fast track innovation while having guardrails. And I think that's where something I mentioned earlier, having the whole human in the loop becomes very important. Making sure that the solution being designed for that individual or that group of individuals are actually a process of the product design. Like I think what Srikanth also mentioned earlier, you can't build for pilot and then go to scale. I think it's important to build for scale and then to build that. But it's okay, we'll do this first, we'll deploy. I think there's a question by Satya also, something around ashas and why, did we miss steps around digitization and digitalization? I see that on my screen. I don't know. So I think just making sure that we are including the users and the consumers in the actual design process would fast track innovation. And that's something where public-private partnerships, also something I think Srikanth was alluding to, come to the fore. When governments can't be at the cutting edge, or they could probably be, but they aren't right now. And you have the private sector which wants to go all gung-ho. So making sure that we are bringing the two together. The third thing I really think is around capacity building. As something which will get missed, and that's where I think one of the warning signs that somebody else was earlier talking about, can AI become a worry, is when you don't have the capacity to actually use that AI tool, right? Something that probably UPI did very well for us is it was a very simple transaction. All of us love using it. There was no obstacle in our minds. There was a lot of safety which was ensured. So if we are able to provide a similar seamless, experience, whether that's on the UI UX front or, the safety, the privacy front, we're able to communicate that and build capacity, not just of users, but of also regulators. The government shouldn't be scared to use AI as well, right? In their own administrative processes, not just on a patient's bedside. That's where we really will be able to make sure that innovation with guardrails moves hand in hand, and we have safe and responsible and also ethical AI being deployed at scale.
Thank you, Dr. Surdas. Well, thank you to our panelists and all of you for such a rich conversation. It's very difficult to weave this together in few takeaways. Let me try. I'll try to keep it short. I think for me, the biggest takeaways were validation must be contextual and rigorous. Governance cannot be an afterthought. An inclusive governance means confronting data absence, right? What ties this together is a simple truth. Health data governance isn't a constraint on AI innovation. It's a precondition for AI that actually serves universal health coverage. If you haven't registered for the main India AI Impact Summit, please do so now and keep pushing these conversations forward. A big thank you to Dr. Suhaila Kapoor, Kirsten Matheson, Srikanth Nadamuni, Samir Kanwar. We look forward to seeing all of you at the summit.